The Delta variant of COVID is now the dominant strain worldwide, accompanied by a surge of deaths around the United States, almost entirely among unvaccinated people. The stark uptick is in Florida and 4 other states. Rochelle Walensky, director of the U.S. Centers for Disease Control and Prevention, says this is becoming a pandemic of the unvaccinated, adding that 97% of people entering hospitals in the United States with COVID are unvaccinated. Joining me on the morning show, Dr. Sunil Joshi, president of the Duval County Medical Society Foundation. Good morning.
Good morning, Bruce.
So Florida had 20% of the new infections in the nation last week. The greater Jacksonville area is driving the state's surge. And one medical expert put it this way: we may be over the virus, but it's not over us. Fair enough?
Oh, incredibly fair, because I think that people are tired about hearing about the virus, tired about doing all the mitigation efforts. But the bottom line is this virus is not done with us, and the variations that are coming through are making it even more critical that we do the right things, in particular getting vaccinated so that we can stop the spread.
This is not going in the right direction, has not been for 4 weeks. Misinformation about the vaccine persists. How do you counter that?
Yeah, I mean, it is important for us to continue to educate people about the safety and effectiveness of these vaccines. You know, you'll hear stories of, oh, my friend was vaccinated, they still got COVID. Well, no one ever said that you will 100% not get COVID if you were to be vaccinated. But what we are saying is that the chances of you requiring a hospitalization or having a severe illness requiring ICU admission is significantly lessened. I mean, even here in the community, we're looking at 90 to 98% of all of the hospitalizations that have occurred recently are in the unvaccinated, which really does make it, as the CDC director said, right now, a pandemic of the unvaccinated people.
You know, perspective is interesting. Dr. Fauci said, if we had this kind of mentality with polio, we'd still have a problem with polio. True enough?
Right. Right. That's so true, is that, you know, back in the days, you know, people did listen to science, listen to medical experts about the importance of vaccinations, and we were able to eradicate smallpox, so don't forget about that one, and significantly decrease polio. Of course, this virus is a little different than some of those. The variations are rapidly occurring here, but still, that's the same point here, is that vaccinations can really help us get towards closer towards immunity.
Schools are back in session in a few weeks in California, and in some cities, kids will be wearing masks because the Delta variant affects the younger crowd, the unvaccinated. Governor DeSantis is pretty adamant, no masks. Can we be that adamant?
Well, I mean, you know, again, this is where we go back kind of to what the CDC recommends. And so, you know, the CDC recently did loosen a little bit of its recommendations towards schools and children in schools, especially those who have been able to be vaccinated, the 12 and up crowd, which is kind of our late middle schoolers and into high schoolers. But it doesn't say much about those folks who have not had a chance yet to be vaccinated, the kindergartners through 6th, 7th grade who haven't even had an opportunity to get the vaccine. We do know that that the virus can spread from adults to children and from children to adults. Typically, what we saw last year is that it didn't spread as much between children, but you got to remember last year we were wearing masks in school and we were doing social distancing. So we don't really know if that would be the case here. The Delta variant does seem to be targeting more of the younger population. And so it would seem that if we were going to follow CDC recommendations, which is that, yes, they can loosen mask requirements, except for in certain conditions, in particular if there is large community spread, which we do have here in Northeast Florida, and if there's low vaccination rates, which we also have in Northeast Florida, and that group from 5 to 12 has not been vaccinated yet. So again, this is not something that's up to the Duval County public school system. It is from a higher level at the state level, but it is something that I think they should be considering.
Bit of a tug of war on the issue of booster shots. Pfizer says, look, you know, we're going to go ahead and do some testing. We think that maybe people should get booster shots. The CDC, Dr. Fauci, and some others say, not quite yet. What's your take?
Well, I think just like anything else, it's very important that even with booster shots, that it be investigated thoroughly to try to make sure that we're minimizing the risk of vaccinations as well. And so I think this is part of, you know, you have that challenge. You have the group of people that say, well, gosh, the vaccine got approved too quickly. And then you have the group of people that are saying, why aren't we getting the booster yet? Well, again, it's important that you let science do science and understand that things are safe and effective before making these, recommendations going forward.
You know, some people worry that this winter can get very dangerous. Others say, look, you know, COVID may be endemic, like the flu, and not pandemic. Is this just a wait and see proposition for us?
Well, you know, and COVID certainly could be endemic like the flu and be one of those things that we all ultimately get exposed to over time. But the flu also puts people in the hospital, and COVID is putting people in the hospital as well. And so, yes, it's something that we need to be still concerned about going into the winter months, because we don't have a large percentage of our population vaccinated, especially here in Northeast Florida. And so we do still run that risk of our hospitals becoming overburdened by hospitalizations, you know, and so that can get us into a situation that we saw in New York City and San Francisco in early 2020. And we don't want to see that happen. Will COVID be with us for a while and be more endemic like the flu? Possibly, but we need to do what we can to mitigate its spread now in these stages so that we can keep our hospitals open and the rest and our entire community safe, not just our COVID patients.
Would this be a whole different football if it had not been a political issue and doctors from the get-go said, you know what, go ahead and get the shot?
I feel like, you know, that still continues to be one of the missing pieces that we have in this entire vaccination effort, is that physicians, healthcare providers, people that the folks that people trust on the ground have not even been given a chance to provide the vaccine. The vaccine has gone to the big box grocery stores, the pharmacies, and of course the large vaccination centers. And that was a great approach initially when the demand for the vaccine was very, very high and the supply was low. Just get the vaccine out to as many people as possible as quickly as you can. We have now reached that point where the supply is exceeding the demand, and there are still people who might be on the fence. You know, there's that percentage of folks who still may want to get the vaccine. They go and they speak with their doctor says, yes, I think you should get it, but I don't have the vaccine in my office. Go to a pharmacy and get it. And then they don't get it. If we had the vaccine in our offices throughout Northeast Florida, when we have that conversation with our patients and can offer them the vaccine at that moment in time, they would be much more likely to get it.
Dr. Sunil Joshi, thank you.